Okay, so we are to the orthopedic part of pelvic floor pain. So I like looking at this schematic and thinking about how beautiful that is, and all these little ridges and all these little ridges are poking out because different muscles are attached there. So when I first meet somebody, pretty much no matter what they are having issues with, I go ahead and take a look at their sacrum fully clothed. So the reason why is your legs come up and they hook into the acetabulum right there, and then they form a part of this pelvic girdle, and then right at the sacrum, which looks like a keystone, like in a building where the wedge comes, and then that keystone is right there, and that's the crux of the whole thing. And then if that keystone is in place, then they can build the building on top of it. And that's what your spine looks like. So if this is wiggled around at all, and 9 out of 10 people, it's wiggled around. Some people have symptoms, some people don't. Either way, layers of the onion, I'm going to go ahead and peel them off. I am finding out that most people that suffer from bladder pain have a lot of stuff going on right here. And it may be simple because that's where all your nerve roots, sacral nerve roots come out that apply, that also innervate at the bladder. So on day one, I'm already putting everything in place, pain, if they have pelvic pain or not. And then I also, if they consistently present the same way, then I teach them how to do that themselves. So that way they don't have to need me to put their pelvis back in place. And the best thing for putting a pelvis back in place is to be stable and to have your organs, have your muscles, your core holding everything in place. So if your pelvic floor muscles aren't jacking with you on one side and hypertone on one side or hypertoned at all, then they can allow everything to move efficiently. So I'm here to help you find what's going on with your posture and help you find what is neutral for you so that way everything can travel the way that it's supposed to. So I look at the position of someone's hips, that obturator internus, that piriformis, all the way up and down the spine, all the way to thoracic spine, sometimes at the neck, because what is happening here is happening directly at the pelvic floor as well. So if someone has pain in their back and they're like, oh, my pain in my back's always been there. Well, why has that always been there? And what can we do to stop this pain in your low back so that way all of this can calm down because everything is connected. So I look at their core strength and at their posture. So if you're naturally sacral sitting, well, then it's doing something different at your pelvic floor. It's making it always hyper engaged. Or if you're always sitting super lordotic and with a sway back, then it's also going to change the pressures at your pelvic floor as well. So it's hard to have this conversation with someone without knowing what their posture's doing. But these are things that if you do not want an internal assessment, I think it is definitely up to you, but is in your best interest. If your shoulder hurt, then you'd want the physical therapist to take a look and touch your shoulder. So if it's the muscles and the pelvic that hurt, then I think you should find a good pelvic floor physical therapist. If that is not an option for you, that is a-okay. I would find a good and if you have some of these other issues, like you have piriformis, and you have sciatica stuff, like your middle of your back hurts, then go find a good orthopedic manual certified physical therapist, and then they can talk you through all of this stuff. And I bet a lot of these symptoms resolve, but maybe not all because you're not looking at the whole picture. So I also look at someone's feet because the posterior tibialis has a branch at the bladder and then runs all the way down inner thigh, inner ankle, and innervates all the way to your great toe. So if you're naturally walking on flat feet, then you could be putting a stretch on that nerve, for example, and then going all the way up to the bladder. So as we fix what's going on at your feet, then your bladder pain is better, which is really neat. So other examples of someone will have testicular pain and they've gone to all the doctors, made sure they don't have cancer. It's very scary. And then they find out that their inner thigh is really tight. Well, their inner thigh is really tight because they do 1,000 of those leg machine, or they do 1,000 crunches. Well, the crunches and that in-out machine refer pain to the middle of those muscles, which share the same fascia at the pelvic floor. So if we can calm down what's going on in abs, calm down what's happening at inner thigh, and the nerve at the inner thigh is that obturator internus, that one that sits right at the base of the bladder. So calming all that down and doing some behavior modifications, especially with exercise, may also be helpful for decreasing your pain as well. Then I threw out a bunch of these nerves. They all have really, really long names, but I want to show you that some of them come out as high as your thoracic spine and then all the way down to the bottom of your sacrum. So if you're having issues at your pelvic floor, it's nice to not just look at the pelvic floor, but to run up and down the spine and see what else can be involved. I hope that as you're going through this, that you are doing a checklist of like, and this is what I do with people is I'm like, okay, we're going to circle this. We're going to circle this. I'm going to star this. We're going to come back to that big question mark. Let's look at what's going on with you and bring this piece of paper in every single time you come in. And that way you can be like, oh, we forgot. I haven't looked at your prolapse. I haven't checked for prolapse because you had so many other things. Maybe you have all of this stuff and prolapse as well. So I hope that this gives you some feedback in finding a provider or being able to treat your own symptoms as you go about with this pelvic pain. I hope that you remember that you are fearfully and wonderfully made. Take care and God bless.